For those who don't know me, this is Maryse Frangi from Cedar of Lebanon FertilityCare Center and the NFP coordinator for the Eparchy of St. Maron. I would like to welcome all of you to this series of talks that we are launching in English tonight, and then we're going to have it again, and we're going to have a different series that will start next week in Arabic. Tonight, we have with us the people who have helped me to organize this event. I would like to welcome all of you. Linda George, the Director of the Office of Family and Sanctity of Life for the Eparchy of St. Maron. Subdeacon Ernest and his wife Elise Karam, the Director of the Family Life Ministry for the Eparchy of Our Lady of Lebanon. And Anne Olek, who is the Director of the FertilityCare Center of Rochester. Anne was supposed to be our speaker for next week, but a plan B, unplanned. She's going to be our speaker for tonight after Abuna Shaber will lead us in prayer and will show a short video that will get people interested, hopefully, in coming back for when we reschedule with Professor Janet Smith. Abuna Shaber, thank you so much for being with us tonight. I know that you had to kind of change your plans now to be with us. So without further ado, please, Abuna, you can lead us in opening prayer.
Thank you. Barak Mor Abun. Glory be to the Father, and to the Son, and to the Holy Spirit, now and forever. Amen. O Creator of life, source of hope and joy, we offer you thanks and praise for your love, for calling us to be your children, for calling us as your family, are your heirs. You created us in your image and likeness, and from the womb of our mothers, you know us, and you called each one of us into a special mission. You loved us and you saved us by dying for us and by renewing our image, which was distorted by sin. You entrusted us as a church to protect life, to defend it from the moment of conception to natural death. You called us also to be your children and to care and to sanctify marriage and fertility and to respect it. You entrusted us as a church. You entrusted us as a church to protect life, to defend it from the moment of conception and to natural death. We petition you tonight to help us to learn more, to be enlightened by our speakers, our sister Anne Olek. Give her wisdom, give her words from her heart and from her mind that's been formed and enlightened by your word. May she deliver her presentation eloquently, and may we all learn from her tonight and be guided to respect life and to respect marriage and to respect the beautiful gift of fertility that you give to us. We ask this through the intercession of St. Maron and Our Lady of Lebanon and our St. Charbel and all the saints. To you be glory and thanksgiving tonight and always and forever. Amen. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Amen. Thank you, Co-Bishop Shabel. Thank you. And I would like to welcome also Co-Bishop Don Sawyer with us and Sister Therese and everyone who's been joining us. And we apologize again for this change in plan. One of the things the Lord has been putting on my heart a lot in prayer lately, follow the inspirations and be detached of the outcome. He's showing me tonight how I had to be completely detached of what I was planning for. So God's will be done. So thank you all for your patience and for sticking with us. I'm gonna share on the screen now, just with the hope this would encourage people to come back once we reschedule this session. I'm gonna share the short video that I've used, which is only 5 minutes. I've used to encourage a lot of people to join us for tonight's session. So okay, here it is. I hope you, can you hear?
Yes.
The pill in 2010 celebrated its 50th birthday. When it came onto the market in the 1960s, many people thought the resulting changes were going to be unbelievably beneficial. One expectation was that the pill would lead to better, more compatible relationships. A person could have many sexual partners before marriage and pick out the one they like best. And couples could cohabit and test out their relationships so they didn't have to rush into marriage. However, using recent scientific evidence, I'm going to demonstrate that the pill and other chemical contraceptives have been very bad for male-female relationships. Very bad. First, let's look at a study in which biologist Klaus Wedekind selected a group of men and rated them based on their evolutionary desirability. They had these men wear t-shirts for a day. At the end of the day, a group of women, not having met these men, were given the t-shirts to smell, then rate the anonymous owner of each shirt based on whether or not they date him, just on the basis of a smell of a t-shirt. Wedekind found that the women who were not contracepting chose men who were at the top of the evolutionary ladder, while the women who were contracepting chose men at the lower rungs of the evolutionary ladder. So if you've ever wondered why some women tend to date losers or why good men can't seem to get a date these days, then this could be part of the answer. Contraception is driving women toward less desirable partners and driving men away. How is it driving men away? In his book, The Decline of Males, the anthropologist Lionel Tiger describes an experiment he conducted using monkeys. He and his colleagues put a tribe of monkeys on an island to observe their sexual behavior. The alpha monkey, whom they named Austin, picked out 3 of the female monkeys to be his exclusive sexual partners. Tiger and his colleagues injected Depo-Provera, a chemical contraceptive, into the 3 females. Austin lost all interest in having sex with them and began having sex with the other females in the tribe. The researchers then injected Depo-Provera into all the females of the tribe. Austin stopped having sexual intercourse with the females and started acting in a confused and turbulent fashion. Then the researchers uncontracepted the female monkeys, and Austin went back to having sexual intercourse with the females. Tiger goes on to suggest that chemical contraceptives can have the same effect in humans. It's amazing that so many women these days are contracepting during the period of their lives when they are trying to attract a spouse. But because they're taking these contraceptives, men are less likely to be interested in them. Do you see the contradiction? Contraception undermines the human body's natural means of attraction, pheromones. Pheromones are the odorless, colorless chemicals that help attract men and women. Biologists from the University of Vienna performed a study in which they showed pictures of supermodels to a select group of men and had the men rate the attractiveness of each supermodel. And of course, they found these women very attractive. Then these scientists showed pictures of ordinary women to these men, but this time they placed something in the same room as these men, something soaked with female fertile hormones, pheromones, and these men unknowingly received them. The men in this study found these ordinary women more attractive than the supermodels shown before. So, ladies, what might we want to conclude from this, all right? That the millions of dollars we're spending on makeup and clothes and everything are undercut by using contraceptives. Women who aren't contracepting are more attractive to men than women using contraceptives. So, to recap, from the t-shirt study, we learned that contraception can negatively change the kind of men women are attracted to. Then we learned from the monkey study that men are less attracted to women who use contraception. And finally, we learned from the pheromone study how contraception undermines a woman's powerful and natural means of attracting men. So from each of these examples, we can see that the pill and other chemical contraceptives have not only failed to help men and women have better relationships, but have also made it more difficult for men and women to meet and develop lifelong relationships. The human body is wonderfully designed so that we are chemically wired in order to choose and attract good people. Why mess with that? Learn more about the harmful effects of contraception by listening to Professor Janet E. Smith's Full Talk, Contraception, Why Not?, as well as other talks on human sexuality, available at janetesmith.org. And if you want to learn more about the studies
I figured this would give us an idea about what to expect from her live when God willing will reschedule. So for now, I'm gonna make you co-host Anne, and I'm gonna introduce Anne. So Anne Olek, she's a certified family nurse practitioner and a certified fertility care practitioner and educator that has been teaching the Creighton Model FertilityCare System for over 20 years in the Rochester, New York area. In 2015, she became an educator for the Creighton Model FertilityCare through the St. Paul VI Institute in Omaha, Nebraska. Anne was the past vice president of ethics and standards and past vice president of planning and development of the American Academy of Fertility Care Professionals. Anne is married to Christopher and loves spending time with her children and her grandchildren. And I've had the honor of working with Anne on a few education programs in Long Island, New York, in Rochester, New York, and most recently, by the grace of God, in our own home country, Lebanon. Anne has been the other faculty who's been helping me greatly with the education program. She was scheduled to come in person, but because of the situation, she did not go in November in person, but she was waking up very early, sometimes at 4 a.m. to be with us, either to start lecturing or to pray for the students while they're taking their exam. So I'm so happy that you are here, Anne, and you could have rescued the situation by God's grace. So thank you so much for being with us, and please, the floor is yours.
Okay, well, thank you, Maurice, for inviting me, and welcome everybody. So just ask for your patience as this would have been really polished next week, so I'll do my best and present it tonight for you. So what we were going to present next week would be the charting your cycle benefits for your life, fertility, and marriage. I was going to present part 1, and Melissa Tablata was going to present part 2. So you'll hear part 1 tonight. So what to expect? And a little bit about my journey into being a fertility care practitioner and educator. Talk about fertility as gift or disease, how modern medicine treats fertility, the negative effects of contraceptives, how does our fertility work, the alternatives to contraceptives, talking about natural methods, introducing the Creighton Model System of Fertility Care, who can use Creighton Model and its applications. So here's some great old pictures I have of myself, but the journey started actually in college as I was studying to be a nurse. And, you know, nursing has such a wide variety of fields that you can go into. And my initial trajectory was rehab, spinal cord injury, brain injury rehab. But I had a significant event that happened to me in college where I had to have emergency surgery on a massive ovarian cyst. And when they put me into the pediatric ward, my roommate at the time was a 16-year-old girl who had a blood clot in her lungs due to birth control pills and smoking. And, you know, I just tucked that bit of information in the back of my brain saying, well, obviously this stuff isn't really good, but it's been around a long time. And then fast forward a few years, my husband and I get married, and, you know, this, you know, natural methods was not talked about. Natural family wasn't talked about. I don't remember it being talked about in our pre-Cana. And especially being in nursing, and my husband's a pharmacist, you know, if they ever mentioned natural methods in college, it was to laugh at them. And so, you know, we were struggling, you know, what do we use? And not really knowing where to go, and internet wasn't invented back then, so we couldn't just Google things. So fast forward to, you know, I decided to go get my master's as a nurse practitioner, go into family health. And what I started to see in my nursing career were my colleagues or patients that were suffering from strokes and blood clots. And I can say I could count on one hand the number of friends, colleagues, and patients that I have met that have had strokes and blood clots. And actually just recently, in the past couple of years, I'm working with a young woman who was 20 years old who missed a couple of doses of her birth control, and she doubled up on them, and she actually had a stroke. And luckily she was with her mom, who happened to be a doctor, and she actually had the stroke in front of her mom. She survived the stroke without any side effects. But, you know, here it is, 2023 at that time, and, you know, 1980, women were having strokes. They're having strokes now. They were having strokes when the pill was first invented. The first birth control pill was called Enovid, and it was experimented on women in Puerto Rico, when women were having blood clot strokes and heart attacks back then. And actually, I think 3 women died in the first study. So it's still happening. There's a great book out there called The Greatest Experiment Ever Performed on Women. And it's all about the creation of the pill and the experiments they did on women. And, you know, yeah, maybe the pill is 50 years old or older, but women are still having these side effects, these major tragic blood clots, heart attacks, strokes, and death. So in the early 2000s, I happened to go to a Catholic medical conference, and the guest speaker was Dr. Thomas Hilgers, and that's who is in the last picture. And here he was talking about the Creighton Model of fertility care. And not only was it a method to achieve and avoid a pregnancy, but it was a method to help women understand their cycles, to treat infertility, to treat basic gynecological problems. And that really perked my interest as a medical provider. And I'm like, finally, there's something out there that it's not just a method to achieve and avoid a pregnancy, but we can use it as a diagnostic tool. So that's how I got to where I am. And from that point on, I decided to learn the method, and I fell in love with it. And I said, we need to spread this. And I became an educator. So the question you have to really think about, is the fertility a gift, you know, or a disease? And truly in medical school and nursing school, I remember sitting in a class with on obstetrics and gynecology, and the professor saying, you know, being pregnant is a disease. And, you know, kind of shocked. I was like, what? You know, here is our body. It's a beautiful, our gift of fertility is beautiful. And how does modern medicine treat it? You know, no other organ system in our body is treated like women's fertility. We don't take chemicals to alter our heart or to alter our kidneys or to alter our lungs. We don't, you know, put devices in our body to, you know, affect all these organ systems. But we do it to our fertility. We're treating something that's normal and healthy. And we're, you know, Dr. Janet Smith would say, drug it up, cut it up, and plug it up. So, you know, you really have to think, why are we doing this to our bodies? So what does modern medicine offer? You know, so here are the different, you know, contraceptive methods. You know, they use condoms, male or female condoms, oral contraceptives, the hormonal ring, IUDs, injections, even permanent sterilization, implants into the arm. And then you have the barrier methods like foam and jellies, condoms. There is the contraceptive patch in the diaphragm. So this is all modern medicine can offer women. So before we figure out about fertility, the different methods that are out there, we really need to learn how our fertility works. So the basic concepts of fertility: men are always fertile. You know, a man's fertility begins around the age of 12 or 13 and lasts their entire lifetime. A man occasionally will be infertile for maybe like a structural abnormality or low sperm count, but for the most part, men are always fertile. But a woman is only fertile 1 week out of the whole cycle, no matter if they have long cycles or short cycles. The woman is only fertile 1 week out of the whole cycle. You know, but they're a couple. So as a couple, the fertility is based on the cyclic patterns of the women. So as a couple, the couple is only fertile 1 week out of the whole cycle based on the woman's fertility. So we have the female anatomy. Okay, so You have the ovary, and the woman is born with all the eggs that she will ever have. And as life goes on and she goes into puberty, and then, every time she cycles, she loses more and more eggs, and finally till she hits menopause. You have the fallopian tube. You have the uterus, which when a woman is not pregnant, is about the size of the fist. It's just a large muscle. We have the cervix that divides the vagina and the uterus, and then you have the vagina. So the ovulation cycle. So we have 4 hormones that we're going to focus on. And the first hormone is secreted by the pituitary gland in our brain. So it's called the follicle stimulating hormone. And that follicle stimulating hormone causes one or more of the eggs to undergo follicular development. And so as the follicle is growing around the egg here, as you see, it's getting larger and larger. And right before it as it's maturing, at its full maturity, it's about 2 centimeters in size. And then as the follicle is growing, it's secreting the hormone estrogen. And so the estrogen rises and rises and rises. And as it's rising, eventually it peaks. And the pituitary gland recognizes the peaking of the estrogen and sends out a hormone called luteinizing hormone. And that luteinizing hormone causes the ovulation. And that ovulation is the bursting of the follicle, and the egg is released. Now that follicle collapses in upon itself, and it turns a yellow color, or in Latin, a corpus luteum, which means a yellow body. And as that corpus luteum is progressing, it starts to secrete the hormone progesterone. And that hormone progesterone will keep rising. And if there's no pregnancy, then the hormone progesterone drops and the whole cycle starts all over again. So with the rise and fall of these hormones, we have different things happening into the uterine lining. So we have the menses, where the lining sloughs off, right? So here you have on the left side on the bottom, the menses, so the woman has her period. Then when the follicle stimulating hormone is secreted, you'll start, and the follicle develops, and that follicle secreting estrogen, the lining of the uterus starts to get thicker. And that's called the proliferating phase, where the lining gets thicker. Then after the estrogen peaks and the luteinizing hormone is secreted, which is the brown graph here, and ovulation occurs, and now you have the progesterone being secreted by that corpus luteum. And that corpus luteum, as it's secreting the progesterone, that progesterone causes the lining of the uterus to get super thick and start to secrete a nutritious fluid. In case pregnancy does occur, that baby can implant into that nice nutrient-dense environment of the endometrial lining. If there's no pregnancy, then the progesterone drops and the whole lining sloughs off again. Now, estrogen, not only does it cause the lining of the uterus to start to proliferate and get thicker, the estrogen also stimulates the cervical crypts to produce mucus. And the type of mucus during the fertile time is called type E mucus. And under the microscope, if you look over here on the left, you'll see type E mucus. It looks like swimming channels, and the sperm can swim right up those channels to get to that egg. And we say that the biological valve is open. The woman can get pregnant. After ovulation and progesterone becomes the predominant hormone, the type of mucus that the cervix is producing is called type G mucus. And here you see type G, and it looks like a cobblestone wall, and the sperm can't penetrate. So the biological valve is closed. So on the right here, the top picture on the right is an actual microscopic slide of type E mucus. And when the woman sees this mucus, it's very clear, it's stretchy, it's lubricative, it looks like an egg white. And you can see these little swimming channels And this cervical mucus also acts as a filter so that only the strongest and healthiest sperm get to that egg. And if below here you see the type G mucus under the microscope and looks just like a cobblestone wall, the sperm can't penetrate. So in order to achieve a good pregnancy, you really need to have this nice type E type of mucus. So with the rise and fall of the hormones, you see some visual effects of the hormones. So as the follicle grows and it's secreting estrogen, that estrogen, okay, produces the clear, stretchy, and cervical mucus. Once ovulation occurs, the woman will get that last day of clear, stretchy, moist cervical mucus. And we call that the peak day. Then as the corpus luteum is producing the progesterone after ovulation, the woman starts to feed that thicker cervical mucus, that type G mucus. And her rise, she also has a rise in the basal body temperature. And then as the corpus luteum atrophies and the progesterone drops, that's when she starts to see her menses. So we have the hormones, the rise and fall of the hormones, and then the visual effects that the woman is going to see throughout the month. So there's those key components of fertility. You really need to have good sperm, good eggs, and good mucus is just as important to achieve a pregnancy as the sperm and the egg are. So if the woman doesn't have good, healthy mucus, then she will have trouble achieving a pregnancy. So how does birth control pills work? Now we know how the normal fertility works. What does the birth control pill do, or any of those chemical hormones that are prescribed by the physicians? Well, there are 4 ways that the chemical hormones affect the woman's fertility. So it either prevents ovulation so that the follicle doesn't grow and the egg doesn't get released. It thickens the mucus and it creates that type G mucus, and so that the sperm can't penetrate. And then, oops, sorry about that. It delays the sperm transport, so it slows the sperm down again, because it's that type G mucus that's being produced. But lastly, it prevents the implantation of this new life. So if the conception does happen in the fallopian tube, and as that new life, that new baby tries to travel through the fallopian tube and implant into the endometrial lining, it can't, because the lining, you know, there wasn't that nice rise in estrogen and that nice rise in progesterone to cause that nutritious environment of the endometrial lining. And so that, you know, thick lining isn't there, it's too thin. And when the baby tries to implant, it can't. So we call this an abortifacient effect of the hormonal contraceptive. And so depending on the product that the woman is using depends on the percentage, how often the abortifacient effects occur. So with the pill, it's maybe like 10% of the time they have the abortifacient effect. With the depot shot, it was closer to 50% the abortifacient effect. With the IUD, depending on what type of IUD, the copper IUD was always 100% abortifacient. But the newer IUDs like Skylar and Marina, they do have a chemical wrapped around it so that it will prevent ovulation. Obviously, the barrier methods don't prevent ovulation, but they can be an irritant to the vaginal health or to the cervix. And I've had some clients that say that the condoms or the foams or the diaphragms do cause bleeding. So for each person, it's different, but these products vary on their abortifacient effect. And then again, some of the negative effects of contraceptives, whether a woman is taking the pill to treat a disease or using it as a form of contraceptive, the typical side effects, rashes, weight gain, nausea, vomiting, migraines, mood changes, depression, pain, cramps, bloating, unusual bleeding, prone to infections. Again, the thinner lining, the woman is, that endometrial lining is more exposed to bacteria. Loss of bone mass, that was especially for the depot shot. That caused a lot of bone mass loss. Loss of libido, and you think, women are taking the pill so they can have more intercourse, and they're really not interested in having more intercourse because it really decreases the woman's libido. Then you have the serious side effects, the ectopic pregnancy, the heart attacks, that's what an MI is, stroke, blood clots in legs or lungs, gallbladder disease, and you do get the risk of breast cancer and cervical cancers. And with the IUD, you have an increase in ectopic pregnancies, which with the pregnancy, the baby implants into the fallopian tube, pelvic inflammatory disease, abnormal bleeding. And you see a lot, and I've had a lot of clients that come off the IUD that have abnormal bleeding with it. Infection, displacement of the IUD leads to serious complications. And I've had some interesting stories. I know one gentleman whose parents used an IUD for contraceptive use. They still got pregnant, and the gentleman was born holding the IUD in his hand. And then recently, one of my clients said she has a friend that the IUD was lost. They searched for it, and it had traveled somewhere in her body, and they tried to find it, and they couldn't find it. So these things can get displaced and move. So are there alternatives? Absolutely. So the different types of natural methods, again, based on the woman's signs of fertility. So we have the cervical fluid methods, and those are methods that just look at the cervical mucus that the woman produces throughout the cycle. Creighton Model System is one of those methods. Billings is also a Billings ovulation method, is a cervical fluid method. You have the symptothermal methods. Those are methods that look at the rise in the basal body temperature after ovulation, and they may also look at the mucus, and some do look at the cervix to see if it's opening or closing. The symptohormonal methods are relatively new, I would say in the past 15 years. They're looking at the urinary metabolites that the woman produces during the times of fertility. So every day the woman is actually peeing on a stick, and then they put this stick into a machine to see if they have if there's luteinizing hormone or if there's a rise in estrogen, and they can tell where they are in their fertility. And they may also look at temperature or cervical mucus. And then the lactational amenorrhea methods, and this is the woman that's doing ecological breastfeeding. They're nursing whenever the child wants to nurse. So they're nursing a lot throughout the day and throughout the night. And we know that, nursing suppresses the woman's fertility, and it could suppress it for months and even up to a few years. So I'm going to talk about the Creighton Model System. So again, it's one system, which is the beauty of the Creighton Model. It's one system from puberty to menopause. And we actually like to teach teenagers, I would say girls that are in high school, have them learn about the fertility, be able for them to be able to track their cycles so they understand, when they're going to get their period next, or, when they have some PMS symptoms. Well, it's this time of the cycle. And so they understand, their bodies. And then by understanding your body, you can really take care of it and appreciate it and protect it as you grow. So one system from puberty all the way through menopause. So the Creighton Model FertilityCare System was created by Dr. Thomas Hilgers. He's in Omaha, Nebraska, and he worked out of the Creighton University. And he started in the 70s doing all his research, and then he published in 1985 and started the Pope Paul VI Institute. And that is, again, located in Omaha, Nebraska. It's a standardization of the mucus observation. And this is the beauty that what Dr. Hildreth did. At the time, women were looking at their mucus observations and there was no language to describe it. Everyone was describing it in a different terminology. And he's like, no, we have to be able to standardize the mucus observations so that we're all speaking the same language. And so the doctors are learning it, the practitioners, the clients. And so when we're reading a chart, we know this basic language that it's been created, and we can all understand it. Women can use it no matter what reproductive category they're in. And it can be used as a diagnostic tool with naprotechnology. And naprotechnology means natural procreative technology. And this is the medical science workup that the doctor can use with the Creighton charting so that it can diagnose and treat women's gynecological problems or infertility. And we really encourage, well, you have to, in order to learn the Creighton Model System, you are required to take classes by a trained fertility care practitioner or instructor. And I can't tell you what my bottom thing here says. Sorry, my thing is blocking the last one. Worldwide, yes. And you can go anywhere in the world, and it is, you find practitioners all over the world in different countries, Australia, New Zealand, Korea, South America, Mexico, obviously United States, Canada, Europe. You can just go onto the website. There's the Fertility Care Centers of America. There are also the Fertility Care Centers International. If you do live internationally, you can go to that website and look for a fertility care practitioner in your country. So women who, again, the different reproductive categories that can use the Creighton model. You can have regular cycles and use the model. You can have irregular cycles and you can still use the Creighton model system. You can be anovulatory, meaning you're not cycling at all. And again, the doctors can work with you to try to figure out what's going on. Women who are breastfeeding postpartum, if you're post-contraceptive, coming off the pill or the shots or the IUD, you can use the method. And even if you're perimenopausal, and perimenopausal is those 10 years before menopause actually begins. So it doesn't matter what type of reproductive category you're in, you can be using the Creighton model system. So couples who use the system, you can use it to achieve or avoid a pregnancy, to monitor your fertility, to treat infertility, and to treat gynecological health problems. And I do work with single women who, you know, maybe they have really bad PMS or they have polycystic ovarian syndrome or unusual things going on in their cycle. And we teach them how to chart their cycle so that they can work with a naprotechnology medical consultant. So the benefits of using the Creighton model system. So it identifies the times of fertility and infertility in a woman's menstrual cycle so that a couple can achieve or avoid a pregnancy. It views the healthy function of the reproductive system as something good and desirable. It's not a disease to be suppressed or destroyed. And it views fertility as the responsibility of the couple. Okay, it's a shared family planning system. It's not the woman's responsibility. And we really encourage couples to learn the method at least 6 months to a year before they get married. That way they have a true understanding of their fertility when they go into their marriage. So this is just a woman who gave blood every day to show us where her hormones were and how it correlated nicely with the Creighton model charting. So on the top here, you'll see this is one woman's cycle. The bleeding here in the beginning is her menses, and then she has 5 days of infertility. And then the white stamps with the baby is her fertile time. And then you end up, after the count of 3, peak plus 3, you see another plain green stamps again, and that's her infertility. And so here, the black bars here are as her estrogen rises, eventually it gets to be above 20 nanograms, and you start to see the production of cervical mucus. The peaking of the estrogen is here on day 17 or 16. And so the day after estrogen peaks is when ovulation occurred. The estrogen starts to drop, but it eventually, the progesterone from the corpus luteum starts to rise, and that counteracts that estrogen and dries up the mucus. And then the rest of the cycle is dry. And then if there's no pregnancy, the progesterone drops. So in a typical Creighton model charting, what we would see here again is that this top line here, the woman have her menses, and then she has a series of dry days, which is her infertility. And then the white stamps with the babies is her time of fertility up to after the count of 3, and then back to infertility at the end of the cycle. So again, you can see how nicely as the estrogen rises, you see the time of fertility, and then the estrogen drops after ovulation, and then as the progesterone rise, you see the time of infertility. So the couple will be able to know on any given day if they're fertile or infertile, and they can use the system how they choose. You know, if they want to use those days of fertility to achieve a pregnancy, or if they were trying to avoid for a good reason, then they wouldn't. And then in terms of the NAPRO technology, so we're looking at women's charts, and we know what normal looks like, which is the cycle, what you just saw before. Just going back to it, a woman typically has 5 to 8 days of mucus during her fertile time, and they typically don't have any unusual bleeding. So there are these certain biomarkers that we look for that are in normal fertility. And so when we see charts like these there's 4 different samples here, cycles here, and these are abnormal. And so the doctor is looking at these cycles, and we can tell from what we know is normal. So abnormal really jumps out at us. So in this first cycle here, the woman only has 1 day of mucus, and we know a typical mucus cycle is 5 to 8 days. So this woman has poor mucus production. And so the question is, what's going on with the follicle, or what's going on at the level of the cervix? Maybe the follicle isn't producing enough estrogen, so that's why the cervix isn't producing enough mucus. Or maybe there is a good estrogen, but there's not enough estrogen receptors on the cervix. And so she's not producing enough cervical mucus. So this woman here would be infertile in this first cycle. This second cycle looks great. The first part of it, she looks like she has normal menses. She's got great mucus, but a typical post-peak phase after ovulation happens is like 8 to 16 days, and her post-peak phase is only 5. So she's at risk for miscarriage. And typically this is low progesterone going on in her cycle. The third cycle here, again, looks like normal menses. She's got great mucus, but she has 5 days of pre-period bleeding. This is a sign of low progesterone. It does put her at risk for miscarriage. It also could be she may have terrible PMS. Again, all this is from low progesterone. In this last cycle here is abnormal bleeding. She has 2 weeks of menses. She has no mucus, And then she has intermittent spotting here twice during the cycle. So this could be a few things. It could be hormonal in nature, maybe her, I've seen this pattern with women who have polycystic ovarian syndrome. It could also be structural. Maybe there's some polyps, maybe there's some fibroid tumors, or lastly, it could be cancer. So the charting now becomes a medical record. You know, the woman is going to learn all about her cycle. She knows what's normal for her. And so when these abnormal things jump up, she'll be the first person to recognize it and should be able to go and seek, you know, medical attention. So it's this, it eliminates the guessing game, you know, like I remember going to the doctor and saying, you know, I'm really having bad PMS, but not knowing what my cycles look like. And then once I started charting, you know, I understood, like I had a very similar cycle here with this low progesterone and a lot of premenstrual bleeding. So, you know, you can become, the woman becomes an advocate for her own fertility and for her own menstrual health. So the research effectiveness, so using Creighton Model System to avoid a pregnancy in perfect use, it's 99.5% effective, while user effectiveness is 96.8. So 96.8 is human beings using the method, and there's obviously error because no one's perfect. And so it has the same effectiveness as the pill without any of the side effects. And I always tell my clients, I learned from a wise instructor, my own instructor, and she said, Anne, I would never want to teach a method that was 100% because it takes God out of the picture. So I tell my clients, it's 96.8% effective and God takes 3.2. The effectiveness for the couple to achieve a pregnancy with no history of infertility. Couples using the method for in that first cycle of trying to achieve, 70% will achieve in the first cycle, 90% will achieve by the third, and 98% will achieve by the 6th month. Currently, modern medicine says if you go 1 year of random acts of intercourse, then we'll do, you know, the workup to find out why you're not achieving a pregnancy. Dr. Hildreth says, no, we know by the 6th month, 98% of couples will achieve a pregnancy. So if they're not achieving a pregnancy by the 6th month, then we should start doing the workup for infertility. There's no reason for a couple to wait a full year if they aren't actively charting. And then the effectiveness of couples to achieve a pregnancy with a history of infertility is 20 to 40% will achieve a pregnancy on their own over a period of 8 to 12 months. But with medical or surgical treatment, Dr. Hildreth has up to a 80% success rate, but it truly depends on the diagnosis. My colleague, Dr. Angela Kristen, the third presentation of the seminar on March 26th, will be talking more in depth about NAPRO technology and the patients that she's been working with and how she's been treating couples with infertility or other gynecological issues. So I want to talk about fertility apps. There are a lot of fertility apps out there now. And the majority are not designed to avoid a pregnancy, nor are they founded on evidence-based research. They're just an app to monitor the woman's cycle. So they are difficult to assess because they're not evaluated in peer-related literature, and they don't teach couples how to evaluate the signs of fertility. So on Dr. Hildreth, we do have an app for the Creighton Model System. When it was in beta testing, they found out if they gave the couple or the woman the app right away, the woman didn't learn the system. They were just focusing on learning the app. So we don't give the app out until the couple or the woman has attended 5 follow-ups and they understand the Creighton Model System and they understand what's going on with their cycles. And then after that point, then we get them access to the app. So it's really important. A lot of these apps, again, are not designed for avoiding a pregnancy. They're just charting the woman's cycle. And then I actually had one client who did use one of those free apps. And so she was going to send me all the information from her app, but something happened to her phone. And when she went back to the app, all the data was missing. So a lot of these apps they're not HIPAA compliant. They don't, store the data. So with Creighton Model app, it is a HIPAA compliant app. I can talk to my client via the app, and she can share with me her chart, and it's all encrypted, and the data will never disappear. So that is the end. For more information on introductory sessions in Rochester, you can go to the FertilityCare RochesterNewYork.com. You can follow us on Facebook. And we have 5 practitioners in Rochester, and we do in-person or telehealth visits. So there you go.
Thank you so much, Anne.
Question.
Thank you. Thank you so much. Before we take questions, just to give everyone an update, we apologize for the last minute change, and we thank you, Anne, for coming to the rescue. So Professor Janet Smith will be with us next Tuesday. That will give us 1 week to promote it more. Hopefully we'll have more people also tuning in. And the following week, March 26th, Dr. Angela Kristen and Melissa Tablada will be our speakers on Tuesday, March 26th. So we've done some changing around, but thank God it worked out. And thank you, Anne, for being here tonight and for being able to present. And we will open it for questions now. And also, as Anne said, we all have some social media pages that you can follow us through it. We have for Cedar of Lebanon, Instagram, Facebook. We have for the Office of Family and Sanctity of Life. Also, we have Instagram and Facebook, and we have a website. And you can check all of that in the chat where we posted the links for you. Any questions, you can type them in, or you can just raise your hand and ask us. Yes, we can put them in the chat. Okay, so one question that came to me, yes, you can send me your questions. Feel free to do that, and I can just share them. How does someone achieve good mucus, and how to increase cervical mucus to achieve a pregnancy?
So if someone doesn't have good quality mucus, like that typical 5 to 8 day of good quality, stretchy, clear, lubricative mucus, the medical consultant can prescribe some medication. Some of it is over the counter. Typically they can do Mucinex. I'm drawing a blank. Sometimes they use the antibiotics like amoxicillin.
Vitamin B6 sustained release.
Vitamin B6. Thank you. I was stuck on
yes,
vitamin. Yeah. Vitamin B6. So, but some of these things really, need to be monitored by the physician. Like vitamin B6 in high doses can cause neuropathies. So these drugs need to be monitored closely with the physician. So we just don't recommend them to everybody.
And I want to add to the question that was asked, the best thing that can be done for couples struggling with a low sperm is to increase the quality of the cervical mucus. So that would increase the chances of the sperm being able to survive and the couple achieving pregnancy. So really the quality of the cervical mucus is very, very important for the fertility of the couple.
Right. And for men, some of the basic things like no hot tubs, no, super endurance things, like friction with bicycles, stuff like that. And, the underwears that aren't tight, like boxers, things like that.
Yeah. How about nutrition foods to increase the good quality of mucus?
That I can't think of anything that we've, I'm thinking of in terms of diet, like women that have endometriosis or polycystic ovarian syndrome, the doctors may put them on a gluten-free, dairy-free, sugar-free diet to decrease inflammation. But I don't know of any foods themselves for cervical mucus. But I think one of the things also, make sure that you're not dehydrated.
Yeah, I remember when I read the book Fertility Cycles and Nutrition, they said something, they did not talk about the cervical mucus quality, but like walnut, avocado, these things can help the ovaries produce the ovarian hormones. So maybe that might lead to good production of cervical mucus, but they did not emphasize on it specifically for the quality of the cervical mucus.
Right.
Okay, while we're waiting for more questions, I just want to let you know that the first step to learning the system is to attend an introductory session, and we have one coming up on Saturday, March 23rd, online at 10 a.m. Eastern Time with Perla Majd, one of our practitioners in Lebanon, and myself. And when you were listing all the countries, I put in the chat, even Lebanon, because we have Lebanon now. We're teaching it in Lebanon, so.
That's right.
Any other questions from anyone present here? And I know you were not ready for this presentation tonight, so we still can take more questions about this topic even next 2 weeks. But if anyone has any questions before we just close and remind everyone of our change to the schedule.
Well, I think I have questions for everyone, how did you hear about natural methods? Was it like your own research? Was it from like you attended a pre-Cana or whatever?
Anyone present who would like to answer, you can put your answer in the chat.
I had mine in pre-Cana, but that was a very long time ago. They used to give pamphlets, and I'm actually from New York, and I lived in Rochester as well, and I'm from Westchester County. So I've like been where you are and where you've been in that area. But over 30 years ago in Westchester County at the pre-Cana, they did introduce us to natural family planning. So that was nice. I don't know how extensively that's done, and it was in person. And they gave us pamphlets. So it wasn't, completely explained, but they had couples that came and spoke, and some of them actually used natural family planning. So that was, yeah. But like I said, that was a very long time ago.
Right. And then back then, the only method pretty much was like the symptothermal method.
Yeah, probably.
And maybe the Billings, yeah. And Creighton was just coming out.
Yeah. Yes. So, but I mean, I think that everything about NAPRO, I love that he researched it. I love that he came up with statistical, just information that's so important, really, for everyone to know, because pharmaceutical companies do not educate in this department. And anytime you have anything, immediately, I have 3 daughters, and I have one that they were talking about with endometriosis, and they immediately want to just put you on the pill. That's just their solution. So it's really frightening that they don't even tell you to look at anything else. So it's nice that we have these. It's nice that I knew, because I'm Catholic and I knew about that, and that there's so many out there now. But Maurice's one, NAPRO, honestly, was, I know from the eparchy and from Maurice leading it and teaching about it, spreading the word about it. So my first time about hearing about NAPRO technology was probably within the last 8 years, 7 years. I can't remember. Maybe it was the last 5 years. I can't remember, but it's more in the short term that I found out about it. But of course, I'm a grandmother now, so I'm in a very different stage. But it's still something that I'm spreading to others. So we all need to do that. But I'll let you take questions from others. And you did a fabulous job. Thank you for educating us.
Yeah, you're welcome.
Yeah, thank you. Diana, you had your hand raised. Okay, someone says, I have a young daughter that have a very abnormal period since day one. We have been on and off on birth control pills, which help, but she really wants to do it in a more natural way. What's a good place to start?
So
she's in the right place now.
She's in the right place. Yeah, definitely. So what we would first start with getting her to chart her cycles. And it doesn't, I've had teens chart their cycle and they've done great jobs. I'm always impressed with the teens that I've worked with. They, are really wanting to understand their bodies, and especially those who have an issue, especially with endometriosis. So first they need to learn how to do the method, learn to chart their cycles. And once we have 2 months of charting, that's when we send them to the NAPRO technology medical consultant. And then that medical consultant will start doing the workup to find the underlying cause. Is it endometriosis, or is it like polycystic ovarian syndrome, or something else, some other hormonal imbalance? But until you get to the root cause, just throwing the pill at it is not going to, change anything. What all the pill does is mask, it forces the women into like normal cycles somewhat. But the minute they come off the pill, all those underlying problems are going to, show up again. So with the NAPRO, we're going to get to the root of the problem and figure out that, and then address the root. And then try to, help the girl, depending on whether it's medicine or through surgery, to have normal functioning cycles. So first step would be to do an introductory session, learn how to chart, and then see the medical consultant after 2 months of charting.
Thank you, Anne. Yes, Diana, go ahead.
Okay, thank you, Anne. That was really instructional. I actually never heard of this natural contraception until maybe the last 5 years through Theology of the Body, and Corazón Puro is like a group that studies theology of the body. But in listening to what you were saying, I have a 22-year-old that overheard the Zoom that I was having, and I thought realistically growing up, had I heard something like this in my school, like she's an example of getting the pill thrown at her as early as the age of 14, 15, because she had irregular periods. So this in public schools or charter schools in the city, is this not allowed, a talk like this? Because I think our teenagers and our youth would benefit so much to hear something so instructional like this. Is it allowed or not allowed?
It's allowed. It's just hard to get to break through.
Right.
Yeah. And to and they have to go by a certain curriculum, and this may not be in that sphere. But there was something that you said.
Natural contraception.
Yeah, natural contraception. We don't call it that. It's natural, it's family planning, right?
Family planning, yes. Thank you for correcting me. Yeah.
Yeah. No, it was something else that you said. It was about your daughter. It'll come to me, but
but thank you. I mean, so then what would it take? Because it would take an army of us knowing, like Maurice and yourself, to get into the schools, into the public school systems to advocate for our girls, instead of having them be open to just getting these pills thrown at them that will get them, put them in danger of getting these strokes and all these things that occur with, my daughter, for example, what happened to her spine, she started freezing up at the back of her neck. It started going numb, and it took that for her to get off that pill that would regulate her periods. And that was scary.
I know what it was.
Okay.
Girls, from the time they hit menarche, okay, the first 5 years of, having their period, is typically abnormal.
Irregular.
And so irregular, sorry, yeah, irregular. And so, yeah, so sometimes with the doctors, would wait. If it's really irregular and they're not cycling at all, look at it. But if they're having cycles, but they're irregular, that may be normal, because typically the first 5 years, it takes 5 years for the girl cycles to regulate.
Yeah. Thank you for that. I appreciate it.
Yeah, and then the other thing is only 10% of women have a 28-day cycle. Okay, only 10%. That means 90% of women don't. And so, who came up with the 28-day cycle as being the perfect thing? I would have to go back into the research, but only 10% of the population have a 28-day cycle.
I just want to circle back to why we don't say it's natural contraception, because contraception means it's not allowing conception to happen. It's stopping that union of the egg and the sperm. When a couple is using a method like the Creighton model, they're not doing anything to stop conception from happening. They're just selecting days of intercourse, days of infertility to have intercourse. So they're not going to achieve a pregnancy, even if they have 10 times intercourse on that day. With every act of intercourse, they're open to life, but the way that their body is designed, it will not allow pregnancy to happen, because the sperm cannot unite with the egg. So that's why it's not. Some people say, oh, this is the Catholic way of contraception, but it's not, and we have to clarify this. So questions in the chat. Orlando, Florida. Gigi, I can share with you. I think I know Dr. Pena is in Orlando, Florida. I'll check and I'll get back to you about that. I don't know if you know anyone, Anne, in Orlando, Florida. I'm assuming it's Dr. Pena.
I know there's a doctor in Kissimmee, Florida, but I think if they go to the Fertility Care Centers of America website,
yeah,
type in Florida, it'll come up.
Yeah. And we have another question. If you and your daughter would like to view an amazing presentation, The Beauty and Eve, to give more detail on what Anne has explained, we could arrange a time with you. Okay, so I think someone put that in the chat, Grace Fertility Care. And yes, we have The Beauty of Eve, we have The Truth Within, we have Wonder of Eve. So we have different presentations for different age. Oh, okay, Carol put this for Gigi. Thank you, Carol. Yeah, so thank you, Carol, for that. We have different presentation for different age also that can help people understand more about that. Yes, Carol in her Grace Fertility Care Center, they do that, and also Fertility Care Center of Rochester, myself, Cedar of Lebanon Fertility Care. We all have all of these presentations available to raise awareness and to not let those girls wait for many years and be on the pill for many years before they find out that there are real solutions for all these problems they're struggling with. If we have no more questions, I think we would be ready to close. And just a reminder, next week we have Professor Janet Smith, so please help us spread the word so we can have more people even joining us next week. And the week after, which would be Tuesday of Holy Week, same time, 8 p.m. Eastern time, we have Dr. Angela Kristen talking to us about NAPRO technology, and Melissa Tablada will talk to us about benefits of charting for your marriage. She's a family and marriage counselor, and she has a lot to share with us. And thank you again. Thank you for coming to the rescue. Thank you, everyone, for being here. I know Co-Bishop Don Sawyer is still with us. I don't know if he's available, if he would like to give us final blessing, if he is available. If not, we'll just have unofficial ending of our session for tonight. Linda, Subdeacon Ernest, and Elise, thank you so much for being here and for sponsoring this and helping us in promoting it. And thank you, everyone. And I hope that this presentation was informative, and we'll get more people to tune in and share this information with others, because we feel, myself and all of us practitioners and educators, we feel we have a responsibility to share this news with everyone, the best kept secrets of the Creighton Model FertilityCare System and NAPRO technology. And we hope you will be ambassadors also for this now on, as you heard a little bit about it, and in the next 2 weeks, you'll hear more about it. So this will be the conclusion of our session for tonight. The recording will be available on cedaroflebanonfcc.com, hopefully by tomorrow morning, and on my YouTube channel also, for anyone who would like to share it with others, to invite them to the rest of this series. And next week also, we will launch this series in Arabic with a few other people who will be presenting, myself included, and a doctor and his wife, and then our first NAPRO technology medical consultant. So we ask you to keep all of our efforts in your prayers, and thank you so much for being with us tonight, and have a blessed evening, all of you. Thank you, everyone. Thank you. Good night. Thank you.
Thank you. Good night.
Good night.
Thank you.
Good night.